maintenance care is what our goal is, and maintenance care is different for everybody. It really depends on how well you take care of your body outside of here, if you follow up with stretches, if you get enough sleep, if you eat healthy. But usually it's about once a month. It just really depends on each person. So what we were saying here, where were we at? Okay, 3 times a week, 2 times a week, 1 time a week. This is the frequency that works best. How long you're in each stage is determined by your exam findings and your x-rays and how long you've had the problem and how severe it is. So for you, I'm thinking we need to keep you in stage 1 for 4 weeks and in correction 6, and then I have you 8 here. I know it's increasing as we go down, but we're taking away a visit. Correction is going to be the most important here because that's when we're going to be going through the rehab care, and we're going to teach you 3 different levels of rehab, phase 1, phase 2, phase 3, and it starts with stretching and then it goes into some resistance type work. And they're all simple and realistic for you to add to your daily routine. So, and then stabilization, this is when you're coming in just once a week, just so we can make sure that your adjustments are holding and your muscles are staying balanced and you're not going to have any flare-ups. So that's the plan. Sticking to this will give you the best results. If you have to miss an appointment, there's an emergency or something that comes up, just give us a call and let us know, and that way the girls can reschedule your appointment. They're going to encourage you to reschedule it right away because they know that, just as I do, that the more consistent you are with your visits, the better progress you're going to have. So we're open from 8 to 6:30, so if you can't make it in at a certain time, see if another time will work, or we'll just move it to a different day that week, or we'll add it to the following week. So, and right here we have keep up with rehab and stretches and exercises. I know I've mentioned this already, but it's super important. Not going to teach you any for this first week or so. We're going to wait until you have some progress, and then we'll move you into the rehab. And the next thing I want to talk to you about is our How to Stay Young class. This class is a class that all of our new patients come to. They're required to come to it because I could sit in here for another 20 minutes talking to you about all the important things that you need to learn, how to take care of your back, but I need to hurry up and get you treated. So what I want you to do is come to this group class that we have. These are the times that we have it. How to Stay Young for the first 100 years. It's about 20 minutes long. So on one of your visits, plan to be here a little bit longer, so that visit might be an hour and 10 minutes or so. And these are the times. So are you planning on making your visits for the morning or the afternoon? Morning? All right. So then you would want to go with our Wednesday 9 o'clock class. You could come in at 9 and go straight for the class and stay for the treatment afterwards. If this is too early for you, then we can definitely do a 12 o'clock. So which one would work for you, you think?
12 o'clock.
The 12 o'clock one on a Wednesday or a Friday?
Wednesday.
Okay, so the next time we have it on a Wednesday is actually next week. So I'm going to go ahead and reserve your time right here. I'm going to put this in your folder, so just bring it with you on that visit, okay?
Okay.
All right, so I'm just going to have you sign here stating that I went over it with you. And I have one more form for you. This is what to expect after your first adjustment. So after your first adjustment, you might not notice a change, or you might feel relaxed and some relief, or you could be a little bit sore, or a combination of those. So all of this are normal responses. If you're sore tonight, make sure that and even if you're not sore, I want you to go ahead and do this ice for 20 minutes, and if you want to repeat this, wait 40. All right? And this is going to go home with you, so you'll know how long to do it for. And right here, no heat pad. So that actually increases inflammation, so we want you to just stick with the ice for now. And number 4 is talking about strenuous activities. So just make sure that you rest tonight and you don't go bowling or go exercise tonight. Number 5 is saying if you need a note that you were here, let me know whenever you get here. That way it will be ready for you by the time that you leave. Number 6 is talking about excuse me, if you have any change in any of your symptoms, make sure that you tell us about it right away so that we can adjust the technique or the adjustment if we need to. Number 7 is saying that you've had this going on for a while with your body, even though your symptoms only appeared a couple of weeks ago. So your body's been compensating for these subluxations, and we have to restore the normal alignment so that your body doesn't have to compensate anymore. So you might notice, right now with your upper back, you might notice your mid-back might be a little bit sore. So that's just all normal as your body's progressing through the treatment plan. So just remember, everybody's body heals at different rates, and these factors determine how quickly you progress, stress levels, amount of sleep. So just be patient with us and with yourself, and your body will definitely make that recovery that it needs. And also, I want to let you know that if I feel that you're not responding as quick as I think you should be, we'll definitely refer you to for more imaging or to a different doctor. But I know you're going to do great here because this is what we see all the time. So I'm going to have you go ahead and sign that one. And I'm also going to put in this certificate in your folder. This is for you to pass on to a family member or a friend so that they can get started with chiropractic too. We do the evaluation for a $25 donation to Interfaith Care Ministry, so make sure you pass that on to somebody. So do you have any questions for me? No? All right, well, I'm going to step out so that one of the girls can step in and go over the financial consult, and then I'll see you in the treatment room. All right, I'll see you in a minute.